Hi guys, welcome back to the YouTube channel The Facial. Now today we'll be dealing about the chapter Gastrointestinal Motility. Okay, there are a few questions framed such as phases of deglutition, movements of stomach, movements of small intestine, gastric emptying, defecation reflex, and various clinical aspects related to this chapter which are very important. Okay, one of the questions of gastric emptying and factors regulating it was also came in my preliminary examinations. Okay, so we'll be dealing with all these topics. Okay, the topics are these are the 6 topics. So let's get started with our first topic, phases of deglutition. Okay, so first of all, the thing to be kept in mind is various movements of the, like, there are two basic movements occurring in the GIT. They are propulsive and mixing. Okay, propulsive and mixing of the movements, stomach. First of all, propulsive movements. Propulsive movements propel the food along the GIT at appropriate rate. Okay, they cause proper digestion and absorption of food. Okay, they are important for the proper digestion and absorption of food. Peristalsis is the first propulsive movement. It is a reflex response. We all know that we have been learning it since our lower grades, that it is when the GI wall is stretched by the food present in the lumen. It occurs throughout the GIT, like from the esophagus to your rectum. Now we will be dealing with the other types of movement. First of all, you also need to remember the peristalsis. This is a peristalsis. Okay, so this is your food particle or bolus. What is bolus? The food mixed with the HCl in the stomach is, or the saliva is known as the bolus. Okay, then it turns into chyme. Okay, so this is your bolus, this is your esophagus. Okay, this is your lower part of the GI tract. Then you need to remember that this is the proximal part and this is the distal part. Okay, now there what happens in peristalsis is that a ring of contractions uh, okay, a ring of contractions arise. Okay, in this also, that neuronal and hormonal mechanisms both are involved. Okay, first of all, the bolus is pushed here by peristaltic waves, that are the rings of contraction, and peristalsis is brought about by meandric plexus. You also need to remember that. Okay, so what do we read here is it occurs only in one direction, from the esophagus towards the rectum. Also, that peristalsis is influenced by neural and hormonal mechanisms. So receptive relaxation in the immediate distal segment, and a contraction in the extremely sorry, it consists of a ring of contraction in one segment and receptive relaxation in the immediate distal segment. Okay, the stimulus for peristalsis is the distension of the gut. Now mixing of movements, it local constrictions of a small segment of the GIT are involved. Okay, these constrictions last for a few seconds. Then muscles of mastication, we all know that masseter, temporalis, pterygoid, medial natter, and a buccinator. The thing to remember over here is the muscles of mastication are innervated by various branches of the trigeminal nerve, mainly the mandibular division. Okay, one more thing to note, that process of mastication is controlled by the nuclei in the brainstem. Now we'll look towards our deglutition, that is swallowing. There are three phases: buccal, pharyngeal, and esophageal. Okay, what is buccal phase? That is oral and voluntary phase. Pharyngeal phase, it is partially involuntary phase, and the vocal cords come close to each other. Now in esophageal phase, it is a pharynx to the stomach. Okay, it is about 25 centimeter in length, and it is also of two types. Okay, primary peristalsis and secondary peristalsis. What is primary peristalsis? It is the continuation of peristalsis from the pharynx downwards. Okay, and secondary peristalsis is amount of food remaining in the stomach, which causes a stretch in the lumen. Again, second stretch in the lumen, which again mechanical receptors are activated, and this stretching initiates another peristalsis wave, which is coordinated by intrinsic nerve system, and it continues till all the food in the esophagus is emptied into your stomach. Okay, now control of deglutition, you should be reading it once. Now, movements of stomach. We all know that the muscular layer of stomach consists of three layers of smooth muscles. Okay, outer longitudinal, medial circular, and inner oblique. Okay, now what are the movements in stomach? First of all, we need to remember that movements observed in the stomach are three types. Okay, movements in empty stomach, receptive relaxation, digestive peristalsis, and fourth is the gastric emptying, that is the removal of the bolus from the stomach. Easy. So movements in empty stomach, again type 1, type 2, type 3. Type 1, mild movements. Type 2, stronger movements called hunger contractions, last for 2 to 3 minutes. Okay, and also the hunger contractions are increased by low blood sugar levels. Type 3 movements, extreme hunger pangs, they are known as. Okay, and they begin like a day after the last meal and reach the greatest intensity in 3 to 4 days. They then weaken up in succeeding days. First movement in the empty stomach, type 1, type 2, type 3, done. Now the receptive relaxation, it is occurs what is the meaning of relaxation? It is active relaxation of the stomach. When should it occur? When the stomach is full. Okay, so what is the volume of empty stomach? It is 50 ml, and it can accommodate about 1 to 2 liter of food. Okay. Now the receptive relaxation is caused by the vagovagal reflex originating in the pharynx and esophagus. Easy. Now the neurotransmitters involved in relaxation of stomach include the vasoactive intestinal polypeptide, that is VIP hormone, nucleotides, and dopamines. Easy. So these are the three two we have covered. Now the digestive peristalsis. What is digestive peristalsis? It begins as soon as the food enters the stomach. It starts in the form of a small indentation on the wall of the and encircles the middle part of the stomach in the form of a ring. Now gastric emptying. It is a very important topic. First of all, what is gastric emptying? It is a process by which the stomach empties its contents into the duodenum. Normally, the pylorus remains closed, partially allowing only foods to pass through it. But it occurs until the stomach is totally emptied, and this pumping action is known as the pyloric pump. Easy. Pyloric pump. Strong contractions push the contents towards the duodenum. You can see in the diagram. Now, factors regulating are consistency of chyme, volume of food, hormones, osmolality of duodenum, neural factors. I have made a mnemonic myself on HCV, HC Verma, the book, famous book. Okay, ONHCV. What does O stands for? Osmolality of duodenum. Okay, hyperosmolar means inhibits gastric emptying. What does N stand for? Now, where N stands for neural factors. Sympathetic decreases gastric emptying, whereas vagal stimulation increases your gastric emptying. What does H stand for? H stands for hormones. Gastrin, cholecystokinin, secretin, and GAP affect your gastric emptying. Okay. CCK is released from duodenum. This is a point to remember. What does C stands for? Consistency of chyme. Liquids empty faster, and smaller particles and liquids empty faster. V, the last V of our tick forms a volume of food. Okay. So this was a part 1 of the topic. Now we have covered the phases of deglutition, we have covered movements of stomach, we have covered gastric emptying. These three topics are bit lengthier, but hence also more important. So please follow me, my channel. If you think that you don't want to subscribe at this point of time, and you will for sure do it in the upcoming future, but please give me your valuable feedback. So those are very important for me. So thank you. I'll upload the second video today only.